Hello and welcome. My name is Dr. Calliope. I'm going to be performing your examination today. Would you mind just confirming your name and date of birth for me? Okay, wonderful. Now let's see here. So we have a cardiac examination up for you today. Is there any particular reason why you wanted to order this examination? Okay, sounds good. Well, before we explain what we're going to do today, I'm going to ask you a few questions. Are you in any current pain right now? Okay. Have you had any changes to your medical history since I last saw you? Okay. And what about your family history? And any changes to your medication list at all? Okay. And any new allergies? Okay. Sounds great. So, I'm just going to make you aware there is a lot of construction happening around the block. Super exciting for those people, but it might be a little loud at times, so I just want to ask you to please disregard any odd noises that you hear, and we'll do the best we can. Okay? Sounds good. So, the cardiac examination. What that's going to entail for us is I'm going to be looking at you as a whole. I'm going to be taking a look at your hands, your face, your neck, your chest, your back, even your legs. We're just going to take a pretty good overview of you and do some different tests. We'll take your blood pressure, take your pulse. We'll listen to all around your heart, your chest area, your back, okay? Is there anything that concerns you about that? Okay, there's going to be nothing invasive. It should not be painful or discomfortable at all. So, do I have your consent to touch and treat you today? Okay, that's wonderful to hear. So, let's get started. Firstly, I'm just going to take a step back and I'm just going to take a look at you from this end. Okay, it's looking quite good. No cyanosis, no pallor issues. Not seeing you struggling with any shortness of breath. That's good. So, now if you could just hold out your hands for me, okay? I just want to take a look at your hands. Take a look at the skin color. Okay. And would you mind flipping your hands over for me? There we go. That's great. Okay. Can you turn them back now? Good. I'm just going to take a look at the nails here. Looking for any nail issues. We're looking for lesions, nodes, anything of that sort. Okay. Now I'm going to have you do a little test for me, okay? So I want you to take your two fingers here, your two first fingers, and I want you to put them together just like this, okay? Right? Okay, wonderful. No signs of clubbing. So I'm going to have you hold your arms out again. This time I'm going to be just checking the temperature of your hands to your arms, okay? Good. Okay. We're symmetrically warm there. Wonderful. Now, I'm going to be taking your pulse in one arm, and then I'm going to take your pulses in both arms simultaneously, okay? So I'm going to get to your right here, and I'm just going to lightly place my fingers at your radial pulse point, and we're going to stay here for a little bit. And we're just going to note, of course, the rate, the strength, the texture, if you will, of the pulse. Okay, that's great. Now I'm going to check both of your pulses simultaneously. The reason we're doing this is we are looking for a radial delay. So there might be an issue with your heart if, for example, your pulse is a little delayed on one side versus the other. Okay, so I'm just going to take your arms gently here, and we're just going to hang out here for a few moments. Okay, that's great. So let me just take a few notes here. Would you mind if I just checked your nails again once more? I just want to check the capillary refill time. So I'm going to press firmly on your nail and release. Okay, cap refill time is less than 2 seconds there. On your other hand here, I'm going to press down and release. Okay, that looks very good. So now I'm going to be checking you for what's called a collapsing pulse. Are you currently having any pain in your right shoulder? Okay, that's great. So what I'm going to do, I'm going to take your arm and I'm going to lift it quite quickly up above your head, all right? And this is going to indicate whether you have a collapsing pulse, which sometimes is just part of normal life if you have a fever or if you're pregnant, perhaps, if one was pregnant. So it can also point to some other not so nice things. I'm going to take your arm here. I'm going to take your wrist in my right hand, and my left hand is going to be around your arm, and we're just going to go ahead and lift. Okay, and we can put that down. Wonderful. Now I'm going to come over here and just check your brachial pulse, okay? I'm going to have to press quite firmly, but it shouldn't be painful at all, okay? We're just going to hang out here for a minute. Okay, that's great. So I want to get a reading on your blood pressure. So we've got our sphygmomanometer right here, and we've been working on your right arm a lot, so let's go ahead and take this on your left. Okay, so I'm just going to grab your arm here and lay it alongside mine, and I want you to completely relax your arm, okay? Take all the weight out of it. There we go. And I'm going to press my thumb into the crook of your elbow, and let's go ahead and take your blood pressure. And again. quite pleased with that. I'm going to take off the cuff now. We'll put that back. Okay. So, now we're going to be moving on to your carotid pulse, okay? So, I'm going to be taking a listen first before anything. We're going to auscultate the carotid pulse, and then we're going to palpate it, okay? So I'm going to come in quite close, and I'm just going to put this at the side of your neck, right at the border of the sternocleidomastoid, between your larynx and that. Okay? I'm just going to listen for any bruits. Okay, wonderful. Now, if I had detected a bruit, then I would not be able to palpate your carotid pulse. So now I'm just going to put my fingers a little firmly at the side of your neck, and I'm going to feel the carotid pulse, okay? Okay, that seems to be great. Wonderful. Now we're going to be checking for your jugular venous pressure. So I'm going to have you turn your head slightly to the left for me, okay? Turn to the left, right? Okay, so now I'm just going to watch your neck. Okay? Do you have any pain in your stomach at all? Okay, wonderful. So I'm going to press down quite firmly on your stomach, actually your liver area, and I'm going to be looking for any reflux in that area, okay? So I'm going to press down quite firmly. There we go. Okay, and release. All good? That's great. I didn't see any trouble in that area. So now we're going to be taking a look at your face, okay? So firstly, I want to take a look into your eyes, all right? So I'm just going to be using this gentle light to help me see if there's any issues with your eyes, okay? I'm just going to put my hand at the side of your head here. Just going to look. Any issues at all, okay? I'm going to look at your conjunctiva. I'm going to pull down on your eyelids, okay? I want you to look up. Good. Okay, no signs of anemia. That's wonderful. So, now I want to have a look inside your mouth, okay? Can you open your mouth for me? That's wonderful. Thank you. Okay. Looking good. So now can you touch your tongue to the roof of your mouth? Okay, that looks very good. You can lay your tongue down, close your mouth. That all looks great. So after this, we're going to move on to looking at your chest and looking at your heart area. So I'm just going to look at you here, and I'm going to look for any scars or deformities on your chest. You haven't had any surgeries in regards to your heart or anything like that, right? I imagine it would have been in your history. Just want to make sure. Okay, that's great. So now I want to be looking at the apex beat in your heart, okay? So that's going to be the mid-clavicular line right here, and I'm just going to go down to the 5th intercostal space. We're going to feel right here for the apex beat. Good, we found it. Now I'm going to be putting my hand on your chest, and I'm going to be feeling for any heaves. Good, okay. And now I'm going to be palpating around your chest for any thrills, okay? That is a heart murmur that I can feel with my hands when I go across each of the 4 valves, okay? Alright, we're going to feel the mitral valve over to the tricuspid, up to the pulmonary, and over to the aortic. Okay. Alright, there were no thrills, which is good. So now I'm going to be taking a listen to each of your valves, okay? So I'm going to be palpating your carotid artery, and that'll give me the first heart sound that I'm listening for. Okay, so I'm going to just put my hand here, and then I'm going to take a listen firstly to the mitral valve. Okay, to the tricuspid. To the pulmonary. To the aortic. Okay, now I'm going to take a listen with the bell of my stethoscope, okay? Start at the diaphragm. Go to the mitral. Tricuspid. Pulmonary. And aortic. Okay, that's great. Just going to note that, and then we're going to do a couple of maneuvers that help accentuate any sounds in 2 of your valves. Alright, so firstly, I'm going to go ahead and auscultate your carotid artery again, okay? Okay, can you hold your breath for me? Great. Okay, now I'm going to have you sit forward for me, and I'm going to take a listen to your aortic area. Can you take a deep breath in for me? Deep breath out, and hold it. Okay, great. Go ahead and breathe normally for a second. Alright. Now I'm going to have you turn onto your left side, alright? There we go. Okay. I'm just going to put my stethoscope in the mitral valve area, and I want you to take a deep breath in for me. And deep breath out. And hold it. Okay, great. You can go ahead and sit normally. So now I'm going to be moving to the posterior part of your chest, which is your back area, right? So firstly, I'm just going to inspect and look for any scars or any deformities in this area. And then I'm going to take a listen to your lungs a little bit, okay? Okay, great. So I'm going to go ahead and step behind you here. Alrighty, let's take a look here. So, I'm not seeing any deformities or any scars at all. So let's go ahead and take a listen. I just want you to breathe in for me. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Lastly, breathe in and breathe out. Great. Okay. So I did not hear any crackling sounds at all, which is good. Now I'm just going to be feeling the lower part of your back. I'm going to be checking for any sacral edema. Okay. Okay, good. Alright, no sacral edema. So now I'm going to be taking a look at your legs and your ankles, alright? So I just want to look at your legs real quick. Right? Now I'm going to be feeling your ankles, okay? I'm going to be looking for any pedal edema here. Okay, that looks good. So, I'm just going to put this down real quick. Make a couple notes, but I find that you are a very healthy person. At least in the cardiac area, that is. That will conclude our examination. Did you have any questions for me at all? Any concerns? Okay, that's great to hear. So, I hope to see you again soon. It was a pleasure working with you today. So we're all done here. You're free to go. I hope you have a whale of a day and a good rest of your night. Thank you.